Hi, I'm Aaron Tarr, and in this video I'll be walking you through the recent research that I've done at Bangor University as part of my master's dissertation project. It's a systematic review investigating the effects aromatherapy as an intervention and how it can impact on anxiety and anxiety levels. Now, the reason I've decided to choose this area in particular is because I find that with previous literature, there's not been much of an investigation into the kind of odors and the environment in that aspect and other sensory processing matters. It's been mainly focused towards a visual component, so understanding how the color of the walls, maybe the carpets, the furniture, the decor, and how those things can have an impact or allow clients to start to form an opinion within the first kind of few moments and interactions in that space. This is important to consider as well, especially in counseling environments and in healthcare settings where anxiety levels may be induced or heightened because of the unfamiliarity or the negative associations with that kind of environment, especially if there is negative implications or is hard work kind of going into and exploring some unknown kind of aspects of oneself. Another important factor to consider is how the olfactory system interlinks with the inner brain. So regions such as the amygdala and the hippocampus are fundamental when responding to anxiety stresses and calming the body or exciting the body in that sense. So understanding these key regions and knowing that when investigating the process of aromatherapy, it takes two main routes to elicit responses from an individual. The first being through the memory system, where if you were to engage with walking down the street, for example, and you smell a certain perfume or fragrance that you or someone you know wears, the smell of freshly cut grass, maybe even basil in a kitchen, there's certain smells that can trigger memories. And if these memories are positively associated, this can have a calming and a familiar effect on an individual. The other component is more of a chemical composition and the compounds that are involved with certain oils. So, in particular, thyme has a high concentration of thymol, which is a stimulating and engaging compound. On the other side of things, lavender has a high percentage of linalool, which is more sedative, and this is being compared to have the same effects as like diazepam, and can even reverse some effects of caffeine when exposed to inhalation of this oil for a period of time. So knowing this, the research has really been conducted to explore and investigate how the inhalation of certain oils in high stress environments can reduce and interfere with anxiety levels, as a result can provide a foundation for expanding the literature into more specific areas such as counseling environments and understanding the implications and kind of correlations that can occur within those spaces. The benefit of this as well is that aromatherapy is a low cost and low labor intensive kind of additional therapy that can complement other factors, and by passively being in an environment, it can also be tailored to an individual, which is also a huge benefit when it comes to trying to engage with behavior or reduce anxiety, especially when maybe starting off in newer sessions and stress might be a bit higher. Moving on to the methodological sections of the review, the main focus was on trying to reduce and mitigate any potential bias that may have occurred. And this was done by having a predetermined search strategy and inclusion-exclusion criteria already set out. This was to encompass different types of aromatherapy titles such as psychoaromatherapy and aromacology under the same overhead kind of title. Additionally, the kind of interventions were limited to being strictly inhalation. This is to kind of keep the whole intervention on a passive and non-invasive measure. And it also requires less actual involvement with the client and reduces any risk that can occur from that. Another factor that was kind of ideally focused on was the reported measures of the intervention. So rather than having brain scans and brain measuring techniques such as EEGs being interpreted by myself and other researchers, which may lead to bias, having self-reported measures such as through the Spielberg State Trait Anxiety Inventory and Beck's Anxiety Inventory, it removed any component of animal studies that are, again, open to interpretation and can actually get the direct subjective experience of that individual through their own accounts, especially when they are comparing a before and an after intervention. With the methods, there was no limitation on what type of oils were used for each study, and also the dosage varied. So in certain papers, more concentration or more drops were involved, whereas in others, they were limited to just a couple of drops, maybe through a water diffuser, as we have here, or through cotton wool, which is another easy and cheap way to administer the intervention. By following the predetermined set of criteria, 11 papers were identified as being eligible for inclusion within the review. Once these were deemed eligible, the results sections were analysed for the reported levels of anxiety, either state or general, depending on what self-report measure was administered. By following these sections, it allowed for a comparison of within groups conditions and the intervention standalone, as well as a comparison between the intervention condition and the control group or placebo group, to see whether engaging in a similar process of inhaling either distilled water or saline had the same impact as an essential oil, or whether there was an element of familiarity and being in that environment which could reduce anxiety levels. Out of these 11 papers, 10 found significant results in the interventions of aromatherapy in comparison to their control groups, whereas one study found no significant intervention across any of the conditions. The table here outlines all of the oils included within each intervention, with the orange bar representing how many times that oil was used, and the blue bar was identifying how many had a significant interaction or a significant result. As you can see, the eucalyptus condition and the lavender condition were both had an intervention which wasn't significant or wasn't deemed significant. The interesting thing to consider is they both come from the same administration process of one particular study, which found no significance across any of the conditions. And questions can be asked whether there was a certain implication with the familiarity of the process, as a lot of the population demographics focused on hospital environments and going through different processes. And in this one, there was a lot of familiarity with the process, and anxiety levels were represented as being kind of low and moderate across the board, which suggests that exposure to the potential process for a long period of time, or repeated exposures, may just have an inherent level and impact on the anxiety levels, thus making the intervention seem less significant. It's important to consider that this familiarity may not always be significant, because one of the studies represented a significant result in the control group, which was no intervention. However, this was not a reduction in anxiety, but an increase in anxiety, and this was over a 30-day exposure period, suggesting that familiarity has an impact to an extent, but it's not as significant as having an intervention with aromatherapy in general. After reviewing these results, it can be identified that aromatherapy as an intervention is significant for having an effect on anxiety levels. This is important to consider because certain environments, such as healthcare or counseling environments can elicit high state anxiety through the engagement of the process. Therefore, things have to be implemented to be able to mitigate or at least reduce that kind of experience, to be able to promote engagement and enjoyment from that overall therapy. This is especially important because aromatherapy can be considered as a complementary addition into the environment rather than a standalone conventional therapy, similar to the way that certain drugs are administered alongside other therapies. This also has benefits because it allows for more of a individual and tailored process to the treatment that's been going on, with the initial stages perhaps involving more of a sedative and calming oil, such as lavender or geranium, for example, and that can help increase the levels of rapport and decrease the initial anxiety experienced in that environment. And once the repeated exposures have continued for a few weeks or a few sessions, the state anxiety from that environment may decrease over time, suggesting that other oils that have more of a stimulating effect, such as peppermint or thyme, may actually be an additional benefit to promote engagement or to start to incorporate more forward-thinking and planning behaviors. However, there are essences that need to be researched in more depth, or at least specified more, because there is a massive breadth of the effects certain oils have, ranging from more physical ailments to more cognitive well-being and burnout essences. There is also a variation between cultures and the implications that these certain smells and odors can elicit. As shown in previous studies where wintergreen mint has had less satisfactory and less pleasurable ratings in more of a UK-based population, where the oil and the scent is associated with medicine, whereas in the US, the scent is associated more with sweets and candy treats, and thus generates a higher pleasure rating. This is also important to consider because in the previous studies, there was a high division between Iran and Turkey as the main population bases, but also the oils primarily focused around lavender and rose being involved in the most studies and interventions. This is important because rose and lavender have origins in these particular areas and have been used for thousands of years, centuries, within the perfume kind of industry and environments, and thus have positive associations throughout the kind of culture. Additionally, damask rose in particular has got ties as being, or is known as, the Turkish rose, which again elicits more of a familiarity and comfortability with certain oils in comparison to others. This is important to consider because again it allows for more variation and more tailoring to a client's needs or preferences rather than being one generic standalone thing that applies for everyone. It does open up a bit more of a complexity to figuring out what a person may desire or benefit more from, but this is again quite a low cost process to kind of engage with for the benefits it can kind of elicit. Additionally, this review allows for more of an understanding of healthcare environments and the administration of aromatherapy, that it can provide a foundation for investigating different spaces, such as counselling specifically, as there is currently no literature investigating the two working together. Overall, this review has highlighted how other complementary therapies may be an additional asset into certain healthcare environments or high state anxiety situations, such as in counseling environments for the first time. This is because a lot of research has primarily been focused on the visual aspects of rooms and spaces, whereas scent is also a key component of individual perceptions of an environment, and as shown by a 10-minute exposure, can have a short duration before behavior change is actually elicited, and is often overlooked as a general understanding of the human experience. It also highlights the need to incorporate more of an organic and natural component to these environments, which can also help to passively induce and benefit an individual with maybe some degree of being tailored towards a specific preference either way.